Hi, Mr. Simon. All right, so IDing the patient, talking to the patient, right? Explaining to them what you're going to do. So then you have to palpate a radial pulse. So if I ask you where your radial pulse is at, then you guys know that you're going to say, I'm going to do right radial or left radial.
Okay.
And then you also have to count your respiration. So I'll ask you how fast is he breathing per minute, okay? And explain to me. So when you guys count your radial pulse, what are 2 ways you can do it? Or 3 ways. So you can
Do 15 or
15
30.
multiplied by 4 or 30 multiplied by 2. Same thing with your respiration. So explain to me how you got it, okay? After that, I'm going to ask you, so stethoscope placement. So front and back. Okay, so right now you guys can practice on each other, but use 6 in the front and then 6 in the back. So you guys remember upper, and a middle, right? For us it's different because of our breath, so we have to, and then lower, and sometimes I like to listen kind of to the side, like mid-axillary. And in the back, you want to turn on. Okay, so upper, kind of middle, and then your lowers are like right here, kind of like above your kidneys. Right?
Okay. Oh, she did it on this side.
So what, I'm sorry?
Let me do.
The what?
The middle one?
The middle, oh sure. So upper, kind of like middle's like right here, and then lower is like right here. Okay?
And then in here, right?
Yeah. And this is like the mid-axillary, and I really like to listen here. Remember, the taller the person is, you may have to listen, higher, a little bit lower, because their lungs are really big, okay? So 6 in the front, 6 in the back. And then how do we move women's breaths?
With her hand down and push up.
Good.
Oh, yeah, that's right.
So I'll definitely put a wheeze, a crackle, and normal breath sounds. Listen to, and normal should sound, everybody listen to themselves, right? You sound like nice and
You hear
Slow.
like the waves.
Yeah.
air, like the ocean, right? Wheezes sounds like a really high-pitched noise. So imagine air going through an airway that's really closed, right? Crackles, depending on the crackle, it's fine or coarse. So I think at this point, I'm okay if you guys just recognize that it's a crackle. The fine and coarse is really subjective sometimes. But coarse sounds more like a washing machine. Like, and then fine, it really does sound like Rice Krispies, like more bloop, 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 bloop. Okay? And it just depends on what's going on in the lungs. Everybody knows how to use a pulse oximeter, right?
Mhm.
So it's placing it on the index finger here, right? Or if you place it on me. And then so I'll have you guys place it on me and tell me what my SpO2 is and what my heart rate is, okay? So as far as like your oxygen devices, I think I'll definitely ask you guys like for your low flow devices, right? So what are some low flow oxygen devices that we learned?
The small value.
Cannula, right? A simple mask, which is our high flow device. We have a high flow cannula, but we also have an air entrainment mask, right? And then for emergency situations, the Venturi mask is a high flow. And then for emergency situations, like your non-rebreather. So I'll give you guys little scenarios like, oh, you have a patient who's just got out of surgery. They need some low flow oxygen. They're not breathing through their mouth. Okay, let's put them on a cannula. Or maybe they're breathing through their mouth and they need some low flow oxygen. I'll try a simple mask, right? This person needs a precise FiO2, so what would I use for precise FiO2? Air entrainment mask. This person's coming in with a heart attack. What would you set him up at?
Non-rebreather.
Non-rebreather. And you guys have your flow meter right there, okay? All right. And then definitely like troubleshooting with your oxygen devices. So if you need to modify anything. So your patient's, their SpO2 is 90 on 2 liters nasal cannula. What are you guys going to do? I can bump it up to 4 or 3, right? Now they're breathing through their mouth with the nasal cannula. Well, let me switch them to a simple mask, okay? And then she wants to initiate correct aerosol device. So definitely know how to set up your SPN, know when to use like an NBI, and then a DPI, okay? So if a patient needs albuterol, you can kind of be the advocate and decide, well, they're breathing okay, they're able to make a nice tight seal around the mouthpiece, let's try an NBI, right? Or or they're having a really hard time breathing, maybe the meter dose inhaler is not appropriate, let's try a small volume nebulizer with a mask or a mouthpiece, okay? And medication, I mean, right now we really haven't learned about medication in detail, but everybody knows that albuterol is a bronchodilator, right? So if I have wheezes, I would give
Alberto.
albuterol, okay? So don't worry too much about the medication. Just know to give albuterol if you have wheezes. Okay? That's it.
Okay.